Good morning, students. So here I come with the part 5 of 100 one-liner series in pharmacology. All these PDF I'll be uploading shortly as soon as I complete everything, and I'll be uploading most of them by tomorrow also. So please watch this part 5 series. It consists of a little bit of CVS, then endocrine and CNS. So students, coming to the part 5 series. Now we start with the CVS and then we'll move on to CNS in this. So canrenone is a metabolite of spironolactone. Spironolactone is a diuretic and potassium sparing diuretic, और उसका metabolite होता है canrenone. Spironolactone is contraindicated with enalapril because it causes hyperkalemia. Both the drugs, they cause hyperkalemia. Then which of the following diuretic is contraindicated in presence of cardiac failure? So cardiac failure में we absolutely contraindicate mannitol. Okay. फ्यूरोसमाइड इज़ वेरी यूजफुल इन रिफ्रैक्टरी ईडिमा. जहाँ पे ईडिमा किसी भी और चीज़ को रिस्पॉन्ड नहीं कर रहा है, वहाँ पे रिफ्रैक्टरी ईडिमा में फ्यूरोसमाइड इज गुड. Thiazides, they cause metabolic alkalosis. Now see, there are so many questions which are based on this, that it causes metabolic acidosis, respiratory acidosis, alkalosis. तो अभी टाइम नहीं है इसके पीछे का कॉन्सेप्ट समझने का. आप अभी रट लो इसको कि thiazides cause metabolic alkalosis. True regarding acetazolamide is that acetazolamide has got a structural resemblance to sulfonamides. Hypercalcemia is caused by thiazide. So because it causes hypercalcemia, so it is useful in renal stones, in CHF with renal stones. Diuretics that can be used in renal failure is furosemide. Furosemide can be used when renal failure is there. Then tolvaptan is used for SIADH. It is a vasopressin receptor antagonist and this is used in SIADH. Treatment in choice for SIADH is hypertonic saline. Drug used in mild hemophilia is DDAVP, which is desmopressin. True regarding conivaptan is that it is a vasopressin antagonist. So tolvaptan, conivaptan are vasopressin antagonists. Then in diabetes insipidus, diuretic which shows paradoxical antidiuretic activity is thiazide, right? Site of action of antidiuretic hormone, we know ADH acts on the collecting duct. Drug of choice for neurogenic diabetes insipidus is desmopressin. Drug of choice for prophylaxis of acute mountain sickness is acetazolamide. Mannitol is used for treatment of acute congestive glaucoma. Whenever there is an acute closed angle glaucoma, then the drug of choice is mannitol. Furosemide causes metabolic alkalosis. So if you remember, thiazides, they cause metabolic alkalosis. Furosemide also causes metabolic alkalosis. True about dorzolamide. Acetazolamide का ही congener है. Dorzolamide, acetazolamide, they are carbonic anhydrase inhibitors. The site of action of furosemide is, so furosemides they act on the thick ascending limb of loop of Henle. ये बस आपको एक विजुअल मेमोरी रखनी होगी इसमें. सो जो असेंडिंग, अपने सामने आप लूप ऑफ हेनले का पिक्चर इमेजिन करो, उसमें जो असेंडिंग लिम्ब ऑफ लूप ऑफ हेनले है वहाँ पे ये फ्यूरोसेमाइड या हाई सीलिंग डायरेटिक्स एक्ट करते हैं. विच डायरेटिक इज अप्रोप्रिएट फॉर कंबाइनिंग विद एस इनहिबिटर्स? एस इनहिबिटर्स के साथ वी कैन कंबाइन thiazides. Now spironolactone is contraindicated with enalapril because when you combine these potassium sparing diuretic with ACE inhibitors, it results in hyperkalemia. Which diuretic causes hypercalcemia and can be used in recurrent calcium stones? We just saw earlier that it is chlorothiazide. So the same fundamental can be asked in different ways also. So thiazides, they cause hypercalcemia. Thiazides can be used in recurrent renal calcium stones. So this is how you have to understand the answer. Which is a mineralocorticoid antagonist? So it is spironolactone. It acts on the aldosterone also. In cirrhotic ascites, which diuretic is preferred? In ascites, due to liver failure, we use spironolactone. Thiazide diuretic does not cause hyperkalemia, it causes hypokalemia. Potassium sparing diuretics, they also act on aldosterone receptors. Drug which causes deafness. Deafness करने वाली drug का नाम होता है ethicrinic acid. Then drug that can be used to produce alkalinization of urine, that is acetazolamide. So answer, acetazolamide, drug used to alkalinize the urine. Which is an aldosterone antagonist? It is eplerenone. Diabetes insipidus, तो फिर हम फिर से देख रहे हैं. सेंट्रल में हम डेस्मोप्रेसिन देंगे, नेफ्रोजेनिक में हम थायजाइड्स देंगे, लिथियम इंड्यूस्ड होगा तो हम अमिलोराइड देंगे, रिकरेंट कैल्शियम अगर स्टोन्स हैं तो थायजाइड्स देंगे, अक्यूट कंजेस्टिव ग्लॉकोमा में एसिटाजोलामाइड देंगे, माउंटेन सिकनेस में एसिटाजोलामाइड, नॉक्टर्नल एन्यूरेसिस में डेस्मोप्रेसिन देते हैं, SIADH दैट इज सिंड्रोम ऑफ इनअप्रोप्रिएट एंटीडियूरेटिक हार्मोन, इसमें हम देते हैं फ्लूइड रेस्ट्रिक्शन, हाइपरटोनिक सलाइट एंड सलाइन फ्यूरोसेमाइड. Now Danazol is a drug which is used in endometriosis, fibrocystic disease of breast, hemophilia, Christmas disease, ITP and angineurotic edema. ADRs of Danazol are weight gain, edema, acne, increased hair growth, hot flushes, changes in libido. So Danazol के ये uses होते हैं, ये ADRs होते हैं. मोटे तौर पे questions commonly आते हैं. Danazol is used in endometriosis and the side effects that are caused are change in libido, weight gain वगैरह. Elagolix and relugolix, they are new GnRH antagonists. They are effective orally. Elagolix is approved for treatment of pain associated with endometriosis and relugolix is approved for prostate cancer. So elagolix is a GnRH antagonist and they are used in endometriosis and prostate cancer. Please remember them. Selective tissue estrogen activity regulator. So the drug which belongs to this group is tibolone. It is also considered as a HRT and is used to prevent vasomotor symptoms and osteoporosis in menopause. So tibolone is a steer. कभी कभी short form में भी आ जाएगा steer क्या होता है. So that is tibolone. Then bisphosphonates are drug of choice in postmenopausal osteoporosis. That is the first indication, bisphosphonates ka. They can also be used in Paget's disease and hypercalcemia of malignancy. Adverse effects, contraindications of steroids. So this is a एक तरीके से निमोनिक टाइप है ग्लूकोकॉर्टिकॉइड्स में. ग्लूकोकॉर्टिकॉइड्स दे कॉज ग्लॉकोमा, then they cause limb muscle atrophy, they cause ulcer, peptic ulcer, Cushing syndrome, osteoporosis, कैटरैक्ट, ऑस्टियोनेक्रोसिस दैट इज एवास्कुलर नेक्रोसिस जो आपने देखा होगा कोविड पेशेंट्स में, देन रीनल फेलियर, ट्यूबरकुलोसिस, इम्पेयर हीलिंग, CHF, edema, infections, diabetes mellitus and suppression of HPA axis. So these are the adverse effects and contraindications of steroids. What is pramlintide? Now pramlintide, it is administered by subcutaneous route. It is a insulin lowering agent. It causes weight loss also and it is approved for treatment of type 2 as well as type 1 diabetes mellitus. So please remember this. Apart from insulin, the only drug which can be used in type 1 and type 2 diabetes mellitus is pramlintide. Right? Main contraindication of bisphosphonate is renal dysfunction, esophageal motility disorders and peptic ulcer. So this is a contraindication. Then zoledronate, which is a bisphosphonate, is given 5 mg once yearly, approved for treatment of osteoporosis. Next we have raloxifene and bazidoxifene. They are used for osteoporosis. Now we know that they are basically SERMs, selective estrogen receptor modulator, and tamoxifen is the one which is used in breast cancer. Raloxifene is used in postmenopausal osteoporosis. And these are they also possess a beneficial effect on lipid profile, breast, endometrium. Major adverse effect is thromboembolism. Osimefin is a new SERM which is indicated for dyspareunia due to menopause. So ospemifene, remember this, it is also a new sperm used in menopause dyspareunia. Centcroman, that is ormeloxifene, which is also called as Saheli. So this is a non-hormonal oral contraceptive and approved for treatment of dysfunctional uterine bleeding. Coming to the thyroid hormones, we have two, liothyronine and thyroxine. Now liothyronine is more potent and more active thyroid hormone, while thyroxine is less potent, but it is the main circulating thyroid hormone. Liothyronine is short acting, so can be used only in emergency conditions like myxedema coma, while thyroxine is a long acting and so it is preferred in long term use in hypothyroidism. OCPs, अब OCPs का ये निमोनिक है. द OCPs डिक्रीज द रिस्क ऑफ, OCP अगर लेते हैं तो ये चीज़ें कम हो जाती है. क्या होता है? ओवरियन सिस्ट, ओवरियन कैंसर भी कम होता है. ब्रेस्ट डिसीज, एक्टोपिक प्रेगनेंसी, नियोप्लेजियास, ओवेरियन एंडोमेट्रियम कोलोन कैंसर को कम करता है ये. एंडोमेट्रियोसिस, फाइब्रॉइड्स, आयरन डेफिशिएंसी एनीमिया, प्रीमेंस्ट्रुअल टेंशन एंड स्केलेटल में इट रिड्यूसेस दी chances of osteoporosis. OCPs are monophasic. We know that monophasic होती हैं, biphasic होती हैं, triphasic होती हैं. Mifepristone, a very important drug. Mifepristone is basically an anti-progesterone drug, and so it is used in the treatment of medical termination of pregnancy. 600 milligram mifepristone plus 400 milligram misoprostol orally, they terminate the pregnancy up to 6 weeks. Serious adverse effect is vaginal bleeding. Single 600 milligram dose can also be used as an emergency contraceptive. So it is also recommended in Cushing's syndrome and endometriosis, breast cancer, meningioma, etc. Romosozumab, it is a monoclonal antibody sclerostin inhibitor approved to treat osteoporosis in postmenopausal women with an increased risk of fracture. It is a new drug, romosozumab. So this is used, remember, it is a monoclonal antibody sclerostin inhibitor used to treat osteoporosis in postmenopausal women. Then another new drug is Cinacalcet. It is used to treat hyperparathyroidism in patients with chronic kidney disease who are on dialysis. Then इसी का एक और drug है eticalcetide. It is a new calcium CASR agonist, and it is also used in the treatment of hyperthyroidism with CKD on hemodialysis. So these, if they'll just see new drugs में क्या होता है, question आता है Cinacalcet and eticalcetide. What is it? It is used in hypercalcemia due to or hyperparathyroidism with chronic kidney disease. Then drospirenone. It is a synthetic progesterone used in birth control pills to prevent pregnancy. It is preferred in women who have fluid retention after taking OCPs. So this is a new drug, drospirenone. Teriparatide. Now teriparatide is a drug which is used in healing of chalk stick fractures associated with bisphosphonate therapy. So this you have to remember, teriparatide is actually a synthetic form of natural human parathyroid hormone, and so it reduces the chances of fractures or broken bones which can be seen with bisphosphonate, so it can be added to bisphosphonate therapy. Then SGLT2 inhibitors, इसमें हमारे आते हैं dapagliflozin and empagliflozin. So ये जो drugs हैं SGLT2 inhibitors, they cause decrease in bone mineral density and they increase the risk of fractures. Calcium and calcitriol, vitamin D होते हैं ये they are used in prophylaxis and treatment of osteoporosis, and calcium is life saving in extreme hyperkalemia. Apart from that, calcium is also approved for the treatment of black widow spider venom and magnesium toxicity. So please remember, calcium is used in osteoporosis, also used in black widow spider venom, and it is also used in extreme hyperkalemia. Then calcitonin and salcatonin, they inhibit the resorption of bone. They are also used in osteoporosis. Please remember them. These are the drugs: calcium, calcitriol, that is vitamin D, and calcitonin. Then what is the effect of antidiabetic drugs on weight? Coming to the effect, there can be questions that following drugs increase weight or following drugs reduce weight. So increase weight mein we have sulfonylureas, insulin, pioglitazone, they increase the weight. Decrease the weight is by GLP-1 agonist, pramlintide and SGLT2 inhibitors. No effect is seen with metformin and DPP-4 inhibitors. Then uses of bromocriptine. So bromocriptine we had studied earlier also. It is a dopamine agonist. It is used in Parkinsonism. It is also used in oversecretion of prolactin, that is prolactinoma. Then it is used in acromegaly, and it causes inhibition of milk secretion. PPH. So postpartum hemorrhage after delivery, sometimes the uterus becomes atonic and doesn't respond to the normal uterine contractions, and then there is a lot of blood bleeding. So what is that called as postpartum hemorrhage? In that, oxytocin is the drug of choice for treatment as well as prevention of PPH. Centrochromin we have seen. Prasterone is an inactive steroid converted to estrogen and androgen, so it is indicated in dyspareunia due to vulvovaginal atrophy. Even earlier also we have seen one drug which was used in dyspareunia due to menopausal dyspareunia, and that was a congener of tamoxifen. This is a steroid, prasterone. देन थर्ड, सेलेक्टिव एस्ट्रोजन रिसेप्टर डाउन रेगुलेटर्स। डाउन रेगुलेटर में नाम आता है फुलवेस्ट्रेंट का, और फुलवेस्ट्रेंट यूज होती है पोस्ट मेनोपॉजल वुमेन with hormone receptor positive metastatic breast cancer. So fulvestrant is basically used in breast cancer patients and in which they are hormone receptor positive. Metformin, this is a mnemonic. Metformin preferred in obese patients, sulfonylureas preferred in thin patients. Now growth hormones controls growth of almost every organ of the body except for the brain and eye. So brain and eye do not depend on growth hormone. Mecasamin is a complex of recombinant human IGF-1 and IGF-3 and indicated for growth failure in cases which are not responsive to GH, that is growth hormone. So अगर growth failure है and उसमें growth hormones से effect नहीं आ रहा है, so mecasamin is a new drug which is used. It is a complex of IGF-1 and IGF-3. Pasireotide is a new somatostatin analog which is used in the treatment of Cushing's disease. Now GnRH agonist क्या करते हैं? They stimulate the secretion of gonadotropin when given in a pulsatile manner. लेकिन अगर आप उसे continuous दोगे, continuous administration पे वो inhibit करेंगे. So please remember this. GnRH agonist अगर pulsatile दोगे तो stimulate करते हैं gonadotropin secretion, अगर आप continuous दोगे तो inhibit करते हैं. Nafarelin and buserelin are given by nasal route. Levothyroxine preferred over T3, that is thyronin, for treatment of hypothyroidism due to its longer half-life. Iodides are the fastest acting antithyroid drugs. So iodine 131 is the most commonly used radioactive iodine and it has got a half-life of 8 days. कई बार question होता है iodine 131 has a half-life of 8 days. Which radioactive iodine is the most commonly used? So it is iodine 131. They are the fastest acting antithyroid drugs. Alpha 2 receptor stimulation inhibits insulin secretion. So alpha 2 receptor stimulation will inhibit the insulin secretion while beta 2 agonist and vagal stimulation will increase the insulin release. That is their physiological metabolic roles. Insulin degludec is longest acting insulin and unlike insulin glargine it can be mixed with other insulins as well. So longest acting insulin is degludec and unlike insulin glargine it can be mixed also. Beta blockers mask all the warning signs of hypoglycemia except for sweating because sweating is mediated by sympathetic cholinergic fibers and not by beta adrenergic fibers. Rapid acting insulins जिसमें आता है हमारे पास lispro, aspartame, clulacin, they are preferred for use in continuous subcutaneous insulin infusion devices. कुछ पेशेंट्स में ये डिवाइस उनके एब्डोमेन पे लगा दिया जाता है एंड उसका एक इंसर्ट कर दिया जाता है सबक्यूटेनियसली. सो कंटिन्यूस इंसुलिन इन्फ्यूजन डिवाइसेस होते हैं, इसमें हम रैपिडली एक्टिंग इंसुलिन्स यूज़ करते हैं. अफ्रीज़ा इज़ अ कॉमन नेम फॉर कमर्शियल नेम फॉर लॉन्ग एक्टिंग इनहेल्ड इंसुलिन. इट इज़ यूज्ड विद लॉन्ग एक्टिंग इंसुलिन इन पेशेंट्स विद टाइप 1 डायबिटीज mellitus. Sulfonylureas except for glyburide and meglitinides except for netaglinide and repaglinide, meglitinides in which we have netaglinide and repaglinide, they are safe in renal failure. Benzodiazepines किस पे एक्ट करते हैं? They act on GABA A receptor. The effect of thiopentone on CNS is quickly terminated because of redistribution. This is something which we have also seen in general pharmacology. The thiopentone shows the phenomena of redistribution. Which drug is contraindicated in acute intermittent porphyria? So acute intermittent porphyria में we have thiopentone which is contraindicated. Flumazenil is a antagonist of benzodiazepine receptor. Shortest acting benzodiazepine is midazolam. Most effective non-habit forming sedative is zolpidem. Remember this. Then which of the following drug is effective in painful tingling sensation due to diabetic neuropathy? Diabetic neuropathy से जो पैरों में हाथों में पेनफुल टिंगलिंग सेंसेशन होता है, दैट इज रिलीव्ड बाय गाबापेंटिन. नाउ दिस इज अ क्वेश्चन ऑफ रेस्टलेस लेग सिंड्रोम. तो पेशेंट डेवलप्स फीलिंग इन द सेंसेशन ऑन द लेग्स एंड रिलीव्ड बाय शेकिंग ऑफ द लेग्स. सो दिस इज अ रेस्टलेस लेग सिंड्रोम. इसमें द ड्रग ऑफ चॉइस इज प्रामिपेक्सोल. न्यू ड्रग रिसेंटली अप्रूव्ड फॉर amyotrophic lateral sclerosis is edaravone. Please remember this. There's a new drug in ALS, edaravone. बेंसोडाइजपिन से हो गया हमारा, ये भी हो गया, रिपीट क्यों हो रहे हैं? रिपीट. Drug of choice for drug-induced Parkinsonism is, so drug-induced Parkinsonism may be used by pyridine. Selegiline is an example of MAO inhibitor. Selegiline is used in Parkinsonism. Then bromocriptine is an anti-Parkinsonian drug which is also associated with peripheral vasospasm. Benzhexol is the drug of choice in drug-induced Parkinsonism. This is again a anticholinergic. विच ड्रग इज़ नॉट यूज्ड इन अल्जाइमर्स? तो इसमें क्या होगा, देखो ऑप्शंस में आपके पास आएगा डोनापेजिल, गैलेंटामीन, रिवास्टिगमीन, मेमेंटिन, ऐसे सब ड्रग्स के नाम आएंगे। तो उसमें कोई भी और दवाई जैसे रोपिनेरॉल इज एन एंटीसाइकोटिक, सो इट इज़ नॉट टू बी यूज्ड इन अल्जाइमर्स. So with this we come to an end of the 100 one-liners. Now the next series is more focused on CNS, and then we'll be moving to chapters of endocrinology. Endocrinology is done. We'll be moving to hematology and anesthetic pharmacology. Anesthesia से related है, hematology है, gastro है, respiratory है. That I'll cover in the next slide. And then we will be moving on to the antibiotics.